Hi, I'm Ruth Chambers. I'm going to tell you about my career, which my medical career has gone on now for nearly 50 years. So when I first became a medical student, then I was interested in any career, I think. I was particularly interested in general medicine in hospital, but I edged over to general practice as I finished my junior doctor training. And that was because I liked working with people. I liked being on the front line in people's houses, not necessarily just the same hospital setting. And as I started to do general practice in my training, I realised more and more how I could do research or quality improvement, or I could be more of a sort of political person fighting for what doctors' rights were, etc. So as my general practice career evolved in my training, I was already thinking that I wanted a portfolio career. But I also wanted a sort of career where I could have a normal family life as well as working in the way that I wanted to work. So I started off as a GP, but by the time I was a qualified GP, I already had one child at home, and my husband very kindly stayed at home and let me work full time while our family life evolved to start with. And we were even able at that time to fit in fostering for 5 years and looking after a child for end-of-life care, which has also given me a lot of interest into end-of-life and palliative care and so on as I've gone on. So my GP career started off as a full-time GP, but it didn't take very long till I felt a little bit bored. I wanted some diversity, and I started at Keele University and I managed to get a fellowship, and a day and a half a week I did sort of masters to start with, which ended up with a doctorate. And there I was then after about 6 or 7 years, having done my doctorate with doctor's health and doctor's stress. And that has given me, you can't just do research and sit on it, you have to publish, you have to go to conferences. So I started going around the world. I was paid to go to Hong Kong to a huge international conference and travel business class. This was a bit of a wake-up call. I did quite a lot of work with the Department of Health and the Royal College of GPs on doctors' health and doctors' stress. And that gave me a real setting for my career, to be always combining my interests, what I wanted to do, my day-to-day work as a GP, as well as that by sharing what I'd learnt, either in conferences, in publications, or with local, regional or national bodies. So my special interests have gone from doctor's health, as I said, that it's also been very much about quality improvement. So for a while I've also been very focused on teaching, and I did quite a lot of teaching books. I got my postgraduate certificate of education from the University of Dundee, and so I've always combined getting those qualifications as I've gone along as well. Over the last sort of 10 years, then I've had more interest in anything in digital technology and how that could actually improve the quality and the diversity, the range, the modes of care that any doctor, any nurse in any setting or social care can provide. Now that's always been for me having a patient-centred drive. So I've always worked with patients, voluntary groups, to help to evolve the materials. And again, that has been my underpinning for general practice. That as the years have gone by, I've either worked full-time, half-time, 1 day a week. I've always kept my general practice day-to-day delivery going to make sure that any research, quality improvement, education that I did was grounded in real life and what was needed. So as I say, the last few years have gone by, I've had the focus on technology-enabled care services. I've become very good over the years about writing bids, and I keep bragging at the moment that over the last 4 or 5 years I've brought in about £1 million in various sources of bids, but that's enabled me as well to do the focus on what I want to do. And that's been about technology, but it's also about helping other people. So medical students have worked with me on this. I've been very pleased to help with helping refugee doctors get settled in the UK and become able to practice here, and that interest has gone on for the last 15 years or so. So with the technology-enabled care services, then that's enabled me to see that we've got to help people whose first language isn't English. We've got to help carers. We've got to be starting to do things so that patients gain from digital delivery in the same way that practitioners do or managers do. And along all those examples of, as I've learnt about this and wanted to share things, I've written books alongside. So at the moment, my most recent handbooks are being published online as well as self-publishing, and they're very much about how you use technology, assistive technology, to help look after people with clinical conditions like atrial fibrillation, but also assistive technology to help people with their independence. Would I change anything? I'm not sure I would. If I've wanted to change things as I've gone along, then I have done. And I've gone down these different routes, which have also kept my interest up. Have I got any tips? I think it's to believe in yourself, to believe in what you can do yourself, and to work out ways of getting there. You might start off by asking a few different people what they think of your ideas, and you have to listen to them, but then they may not be right. So you might think of ways around some of the obstructions that they've mentioned. And then at the end of it, you need to be reflecting, thinking of the best things about your career, how you want to expand it. Is there anything that you could preserve that you need to, which is a necessity? In the same way I've said, I've always worked one day a week as a GP. I don't now, I did retire as a GP, but guess what? I'm vaccinating at the moment with COVID, so I'm actually at practices and having hands-on experience at the front line and with the practice teams. So again, that's one of my tips, isn't it? To always stay in contact with the people that you're working with and for, and who are going to be part of your vision in the future. You'll have a long career like my own. You'll enjoy yourself if you take that path. So good luck to you.